Is adrenal fatigue real? So women come to me and say, I feel wired but exhausted. I'm tired all day, but I can't relax at night. I'm dragging in the morning and anxious in the evening, and I need caffeine just to function. But it makes me feel jittery. Sometimes they crash at 3 p.m. and get a second wind at 9 p.m. And then someone tells them adrenal fatigue isn't real. So they feel dismissed again. So your adrenal glands produce cortisol. Cortisol is not bad. It wakes you up. It helps you stabilize blood sugar. It helps you respond to stress, and it helps keep inflammation in check. The problem isn't cortisol. The problem is when you have a chronic activation. So when stress becomes chronic, and again, this doesn't have to mean trauma. It can mean years of multitasking, overcommitting, undersleeping, overexercising, undereating, constant mental loads. Your cortisol rhythm then can shift. Instead of rising and falling smoothly, it becomes chaotic. Maybe it spikes too early at night, but crashes mid-afternoon. Maybe it stays elevated all day, or it could be flat because it's been pushed too long. So when your cortisol rhythm is off, everything feels off. Sleep becomes very fragile. Progesterone declines. Thyroid conversion slows. Blood sugar becomes unstable, anxiety increases, and women often say, I feel like my body is stuck on high alert and I can't fully relax. Hi, I'm Dr. Casey Tramp. I'm a licensed medical doctor and functional medicine practitioner. I focus on helping women suffering with tough and challenging thyroid and hormone issues. My approach to complicated thyroid and hormone issues is very different from others. In my practice, I utilize the very best of traditional medicine along with the very best of functional medicine to help my patients regain their health and get symptoms under control. Is adrenal fatigue real? I feel like women say that they should be handling life better, but the nervous system doesn't care how strong you are. It cares about how safe you feel. So if your nervous system has been running in that fight or flight survival mode for years, exhaustion is not weakness, it's adaptation. Your body's trying to protect you. So the goal is to restore the rhythm. We do tests where we look at what cortisol looks like through the day. We ask you questions about whether you're waking exhausted but wired, or crashing after meals, or maybe you're wide awake at midnight. And then we begin to layer on support. We regulate your nervous system first, often by doing breath work or helping you with things like brain tap. We stabilize meals and protein intake, and we correct nutrient depletion like magnesium and B vitamins. Then we gently retrain the rhythm through light and sleep hygiene and stress modulation. Once your cortisol rhythm stabilizes, women feel steady again. They don't crash as hard, they become more resilient, and they can handle stress without unraveling. So, is adrenal fatigue the perfect term? Probably not, but stress dysregulation is very real. Your body must feel safe in order to function well. So, let's address it. Visit the link you see with this video to schedule a consultation with our office now. We'd love to explore how we can help you and any unresolved hormonal issues you may be dealing with.